More music on trendybeats.com.
Okay, so it is yet another lovely Tuesday morning, and we coming your way with our mental health show. Oh yes, it is time for our mental health show, and today on the mental health show we're looking at somatic symptom disorder. Somatic symptom disorder, and today it's an all ladies affair. It is an all ladies affair here in the studio. I have Shada Brima and also Emanuela Tembil. And my name is Akusia Kwatma Boachi. We are live on Facebook as always, Fila FM 89.3. Please join us live on Facebook and also share. And it is thanks to Kumsin Matthew. So let me welcome my ladies to the studio. Good morning, Ella, and then Shada.
Good morning, AKB.
Good morning, AKB.
Okay, I hope you're all doing well.
Yes. Please.
Okay, so today's ladies affairs. Please let's pick up.
Okay.
Let's pick up so that our listeners can hear us. Okay.
Okay.
All right. So as I mentioned earlier, we're looking at somatic disorder. So Ella,
AKB.
when we say somatic disorder, what is it?
Okay. So somatic symptom disorder is a condition that causes a person to manifest physical symptoms that cannot be proved by, when you are after being tested, there's no medical alignment with the symptom. So the person experiences certain symptoms, say headache, body pain, and things of that sort. But then after running vigorous tests, they are unable to explain the symptoms the person is experiencing medically. So when this occurs, the person feels extreme anxiety about these symptoms because, for instance, you are dead and you feel like your body is hurting. Then you go and get tested, or you are experiencing symptoms of, say, malaria, and then you go and get tested and then nothing is wrong with you, and it constantly keeps happening. As a result, this person is going to constantly be worried about the symptoms they are experiencing, and it is going to disrupt the person's daily life. Also, majority of the time, when the person experiences these symptoms, say normal symptoms, for instance, if you are hungry and you've not eaten for a very long time, certain times you experience stomach pain. But then when this person, it happens like that, this person will automatically conclude that, hey, I have a cancer in my stomach, why is my stomach hurting? So little symptoms little physical symptoms that the person experiences, this person starts to become extremely worried that something big is wrong with them or something of that sort. Last week when we came, we spoke about illness and anxiety disorder. It's similar to somatic symptom, but the difference here is that with the illness and anxiety, the person is constantly worried that, hey, something is wrong with me. But here with somatic symptom, you experience certain symptoms. That is why you start to worry about something being wrong with you, and then you feel like, oh, I'm very sick, I'm going to die or something. Also, research has shown that in a population of about 100 people, at least 5 to 7 people experience somatic symptom disorder. And then it is very common among women as compared to men. Also, it's quite difficult to diagnose somatic symptom disorder because if someone goes to the hospital with certain symptoms and say test A doesn't explain it, the doctor will obviously try to use another test to see what is wrong with the person. By the time they realize they've literally exhausted all the possible tests that the hospital can run, and then before they now recommend or direct the person to a mental health professional. So before you can diagnose it, or before it even occurs to the doctor that, oh, it's possible that this person is experiencing something that has to do with a mental health condition, it probably takes a very long time, because it will take a very long time for you to exhaust all the other tests to see that to be sure that nothing is wrong with the person. And then people who experience somatic symptom disorder, it's a disorder mostly because it disrupts your daily life and you're unable to do things normally. So basically, somatic symptom disorder is a disorder that makes people experience manifest physical symptoms that cannot be explained by any medical condition. Thank you.
Thanks very much, Ella, for that. So coming to Shada, let's look at the symptoms and types of somatic symptoms disorder.
Okay, so when we talk about the symptoms, the number one symptom is pain. The pain is real, they are usually not faking it. So you experience pain at a particular part of your body. Medical or the doctors are not finding the cause of the pain doesn't mean it doesn't exist. The pain actually exists. And then shortness of breath. Sometimes you feel like you can't really breathe well, like you struggle to breathe, or you don't breathe like you normally do. That's because of the pain that you are going through, and then sometimes the things that you feel are going on in your body. And then fatigue. Sometimes you feel very tired. We know that normally when we all do some sort of work around the house, or even at our place of work, we feel naturally tired, but you realize that you feel like too tired or unusually tired, like every little thing, then you feel like you are extremely tired. Maybe you just even walk a small distance and you feel like you've walked like around the whole city. And weakness. It's normal to feel weak once in a while, especially if you feel like you are not well. Or sometimes when you are even emotionally down, it sometimes manifests as weakness. So when you are having a somatic symptom disorder, sometimes you experience weakness. And then abdominal pain. You can sometimes experience abdominal pain, or should I say that abdominal pain is a symptom of somatic symptoms disorder. And then digestive problem, such as diarrhea and constipation. So when you have this condition, you can sometimes experience diarrhea, that is a running stomach, or constipation. And then people that often exhibit this that have this condition sometimes exhibit specific thoughts. Sometimes they feel like the doctors are not doing enough to address their concerns, because when they go, the doctors will be like they've not really seen any major thing that could be causing that pain. And then they also spend a lot of time worrying about their symptoms and what to do about it, because here's the case, they are experiencing the pain, the fatigue, the weakness, yet when they go to the hospital, nothing significant is seen. So they spend a lot of time worrying about the symptoms that they are experiencing. And then feeling that mild symptoms are an indication of a severe condition. So sometimes you feel like the symptoms that you are experiencing is probably like an indication that there's a bigger condition lying, unnoticed, that hasn't been noticed yet, or that hasn't been identified yet. So so sometimes you think of those things, like maybe every day I complain about experiencing headaches, and then when I go to the hospital they are not doing anything. So I start to think, what if this headache is an indication that there's something major? It's just that they are not identifying the problem, and then they become so consumed with worry about their symptoms, and it affects their daily functioning. So because you constantly experience maybe headache or stomach pain, or even a part of your leg is paining, or a back pain, and then no cause has been identified, or it hasn't been linked to any specific condition, you become consumed with the worry. You worry so much that when you even go to work, you can't concentrate. When you even have to do some normal things around the house, you find it very difficult, because you are constantly worrying. Your concentration is just on your symptoms and not what you're supposed to do. And they frequently go for healthcare checks, even when they are giving all clear, even when doctors tell them that there's nothing wrong. You find them still going to different hospitals, different medical centers to get themselves tested, checked, and all that, because they feel like with the previous hospital or facility they didn't really do much, so they've not really identified what's wrong. And they become unusually sensitive or unresponsive to the medications prescribed. So sometimes they feel like the medications that they've even prescribed is not really doing anything, like it's not really solving their problem. So sometimes when you go to hospital and they prescribe drugs, and you've already made up your mind that this drug is not going to work, then no matter what you do, it's not going to work. Yes, so you realize that they are not responding to the medications that they are giving. or maybe they even take a drug and then they start imagining some side effects. Maybe that the drug is not even responsible for that.
Symptoms which you project, and then already you are sad and you are feeling weak and you are experiencing headache and certain things. You also start to assume that it could be a cause of a bigger illness that is happening somewhere. I'll move on to the psychological factors. So one psychological factor would be trauma. So physical trauma or sexual trauma of any sexual abuse of any kind. For instance, when a person experiences trauma, it increases the person becomes hyper vigilant. Okay, first I was partying here, I was dressed decently, and this happened to me. So because of that, every little thing, the person becomes anxious and begins to worry about the slightest changes the person notices. So trauma makes people hyper vigilant and then more sensitive to things around them. So as a result, they begin to notice every little thing, every little change that happens in their body, and they start to assume that this change could be because I am sick, because I am dying, or something of that sort. Another one would be cognitive factors under the psychological factors. So the cognitive factors, they refer to our thinking pattern. So if you are somebody whose thinking pattern is characterized by a lot of negative thoughts, so anything that happens, even if it's a positive thing that has happened, when you think about it, you start to look at the bad sides instead of the positive sides. So somebody with this form of thinking pattern, when the person experiences any little change, for instance, let's say the person has run, you were running, then you reached where you were going to. When you stand on a normal day, your heart will start beating very fast. But because this person's thinking is characterized by negative thoughts pattern, the person wouldn't even think that it's because I ran, that is why my heart is beating fast. This person will start thinking about huge things. My heart is beating so fast, am I getting a heart attack or something related to that? Another one, I'm moving on to the environmental factors.
Okay.
So learned behavior is one of the environmental factors. So somebody can learn, for instance, you were in a household where, say, your parents were not feeling well or your mom was sick, and then it started with a mild headache, then the next thing a stomach pain, then later on you found out that she had cancer. You also start to worry about the slightest thing that happens to you. If you have a headache, my mom had headache and then she had cancer in the long run, so maybe I also have cancer, that is why my head is aching. And then life events. So for instance, if you lose a loved one, then you become sad already. You lost your loved one because the person was sick and then you are sad about it. So any little thing that happens to you, you also start to feel like, oh, I lost my loved one because of this, so me too, this is also going to happen to me. So you get more sensitive, and then you begin to pay attention more to any slight changes that happens in your system, and as a result you might develop somatic symptom disorder. So these are a few of the risk factors that could lead one to develop somatic symptom disorder.
Okay, many thanks, Ella. So Shada, let's look at the complications that a somatic symptom disorder can bring.
Okay, when we talk about the complications, I'll first of all talk about the higher your risk of developing mental health conditions such as anxiety and depression. So someone with this condition will find themselves worrying so much about their symptoms that a cause hasn't been identified. So you realize that they feel very anxious, and then when you start, it's normal to feel anxious at one point in time, but when it becomes constant, you're at a higher risk of developing anxiety disorder or depression.
Okay.
In the sense that you might feel so down because I keep complaining about this, but nothing is being done about it. You feel like they are not doing enough to help you. So you realize that you keep drowning in your thoughts. Sometimes you don't even want to talk to anybody because you're just feeling down. It's like you start feeling like nobody is even understanding you, nobody is trying to help you and all that. So you are at likelihood or a higher risk of developing anxiety or depression.
Okay.
And then many people with this condition tend to spend a lot because they are moving from one facility to the other, from one doctor to the other, because they feel like enough tests hasn't been done or enough work hasn't been done. So they don't even trust the results, so they have to confirm from different hospitals. And imagine going to, if you're even going to a, a private hospital, you're going to pay so much money because you have to pay for consultation, and then maybe even if they prescribe drugs for you, you're going to pay for that drugs. But if you're going to a public hospital, at least their health insurance will cater for some. But you realize that even if you are going to public hospitals, you are still going to spend some money because you are going to be asked to do tests which the health insurance might not cater for. So you realize that it might cause financial difficulties because you are spending. Let's even say you're not even spending at the hospital, your transportation, because you're not going to walk to all the facilities.
Yeah.
You definitely pick a car. Yeah, so it leads to financial difficulties. And then medication overuse. Most of the time, when you realize that you're experiencing a headache, instead of, sometimes we belittle headaches such that we just go to the pharmacy, get some painkiller, and then deal with it. So, and this person has already even gone to the hospital and nothing is mean, then I realize that the person relies so much on painkillers. Maybe I've tried paracetamol, it's not working, I'll go to Tibidol, very soon I'll go to try, like, you meet someone that has tried every painkiller, every type of painkiller. So you realize that they start misusing medications. And then social isolation. Such a person will avoid social interactions, maybe due to their symptoms, or maybe a friend will come over, let's go out and then have some fun, be like, my back aches so much, I can't even walk. Or when we even get there, I can't sit. So you realize that they stop they stop going out to have fun and all that. So not going out often, you realize that you find yourself mostly by yourself, like you're always in the room alone. When your friends are even hanging out, your symptoms will not allow you, because maybe you experience terrible headaches, you can't step out of the house, some part of your leg aches, or like maybe your legs even hurt, you can't even walk and all that. So it leads to social isolation. And then it can have a toll on our relationships too. Let's say you keep turning down your friends every time that they come to you to go out. With time you might lose connection with them because you don't even hang out anymore. Friends that we used to address or call our best friends while in junior high, right now when we even see each other, if we don't take time, the highest will be is hello hi, because the distance has created, or should I say, it has reduced your connection. You are still friends though, but not as close as you used to be. So if you're isolating yourself often or all the time, you realize that you disconnect with these friends. And also your family, let's say every day you're complaining about a particular symptom and nothing is being done about it, they even get tired of hearing you. Like, they'll get tired of hearing that you have this. They'll be like, every day different problem, every day experiencing this, every day, like, they get tired, they'll get exhausted. So they might not even want to get close to you because they feel like, I have enough going on already to come and add someone's problems to mine. So it might affect your relationships and then all that. Yeah, so these are a few complications. There may be more, and as I always say, it doesn't end here. More research can always be done. Thank you.
All right. So, Emanuela, let's look at how a somatic symptom disorder can be managed.
Okay, so somatic symptom disorder, with the management or treatment of somatic symptom disorder, I'll talk about two main broad categories of treatment. One would be psychotherapy, and then the other would be medication. So under psychotherapy, your therapist can use cognitive behavioral therapy. For instance, when I was talking about the risk factors, I talked about the something has something to do with emotions and things and negative thought patterns. So if you are somebody who has negative thought patterns and then you consistently interpret any physical symptom you experience to be something bad, your therapist could help you identify the nature of your thought patterns and how what you are doing is affecting you and affecting your life generally, and help you to redirect those thought patterns. For instance, I'm using an example outside this.
Okay.
If I'm here with Shada and Shada calls me a mad person, I feel like, oh, we are playing, so that's why she can call me mad. But if a random person outside calls me mad, I'll get angry because of how I have interpreted what the person has said. So if with this kind of situation, mostly it deals with how you interpret the physical symptom. That is why you begin to become anxious about it. So a therapist could help you to notice how you interpret things around you generally, and help you to analyze your physical symptoms so that you stop thinking negatively about everything that happens to you. Another form of therapy could be the psychodynamic therapy. It explores how our childhood and how underlying emotions affects our life generally, how the underlying emotions conflict and contribute to somatic symptom disorder. So with this, the psychodynamic therapy would help you understand what is going on in your life, how you were brought up, things that happened in your past, and then maybe the feelings you have repressed that are causing you to experience certain physical symptoms. For instance, we know that sometimes, when I use an example about when you are sad about something, you start to feel weak or something. Most of the time when I'm there and I've not done anything for a very long time and I'm lying down, I start to feel like my head is aching. But when you get up and then you walk outside, you feel like, oh, okay, it's because I was just indoors doing nothing. So it helps you, I mean, the psychodynamic therapy would help you to go through all this, analyze all of this, and then generally make changes to your life so that you can deal with the somatic symptom disorder. And on to the other aspect of the treatments, the medication. So here there's no specific medication for somatic symptom disorder. Usually medication is not really preferred, because if you give somebody a medication, the person is experiencing a symptom and you give the person a medication, the medication you are giving the person is just going to help the person prove that, okay, it's true, something is really wrong with me, that's why this doctor is giving me this drug. So most of the time, if it's a pain, when they start to treat the pain and they realize it's not going, then they shift it to the psychotherapy as a way to help manage all of those things. But in this case, medication is also given when as a result of the somatic symptom disorder, you've developed a different mental health condition, say anxiety or depression. So the medication could be used to tackle the anxiety and then depression that you have developed as a result of somatic symptom disorder. So basically, psychotherapy and then medication are the ways by which somatic symptom disorder can be managed.
All right, so coming back to you, Shada, let's look at the coping mechanism. How can one cope with somatic symptom disorder?
Okay, so when it comes to coping, no matter what anybody is going through, some things you can't go through them alone.
Okay.
So first of all, I advise that you seek professional help. It's not every pain that is physical. Some of the pain is caused, is there to say all the nice words, help you with the things they're unable to do. Those are the people you should surround yourself with, family and friends that understand your condition and will always be there for you in times of difficulties. So these are a few coping mechanisms.
Okay, thanks very much. So this morning we've been looking at somatic symptom disorder. We've looked at what it is, of course, the types of, that's the symptoms or types of somatic symptom disorder. We've looked at the risk factors, since there isn't really a known cause, the complications,